My friends, this is Dr. B, the best doctor in medicine and the most caring doctor in medicine. After more than 30 years at high level in medicine, Dr. B wants to remind you to never ever forget that Dr. B genuinely loves you. And Dr. B genuinely cares about you, and I say this from the bottom of my heart. Today I want to tell you why is it better to delay as long as possible taking any medication for any disorder, for any health issue. Why is it better to delay as long as possible taking any medication? I want here to introduce you to a very famous doctor that every medical student learn about in medical school. His name is William Osler. He's one of the founding fathers of modern medicine. He is one of the founding fathers of the Johns Hopkins University Medical School. He's a Canadian-American doctor. He passed away a long time ago. But he's one of the founding fathers of modern medicine. And I want to quote what William Osler, that we learn from in first year medical school, said about medication. And I'm going to quote what Dr. William Osler said. He said, and I quote, "One of the first duties of the physician is to educate the masses not to take medicine." Isn't that crazy? Dr. William Osler, one of the founding fathers of modern medicine, one of the founding fathers of the Johns Hopkins University School of Medicine, right? One of the best duties of the physician is to educate the masses not to take medicine. Second quote, "The person who takes medicine must recover twice, once from the disease and once from the medicine." I wish more doctors nowadays would listen to what Dr. William Osler said. Because modern doctors, I mean, they're just like prescription machines. You go, you talk to your doctor, right? He will spend 5 minutes in the room with you. He will quickly get the hell out of the room to go to see another patient so that he can make a ton of money, right? He's going to give you a quick prescription and he's going to disappear so that he can see more patients every day to make a ton of money to support his lifestyle. Medicine in America has changed a lot, and not just in America. I did my medical school and my surgical training in Europe, France, Italy, and Spain. It's becoming over there the same. Remember that the official statistics of and then of course I went to Canada before coming to the United States of America. And I practiced for 2 years in a beautiful gynecological clinic in the small city of Red Deer, Alberta, in the western province of Canada. Red Deer, Alberta. I hated it because it's so cold, freezing your balls over there for 7 months per year. That's why I came to America. But these people, think about this. The American Medical Association official statistics. A doctor in America will spend an average of 5 minutes in the room with the patient, and the patient spends an average of 45 minutes in the waiting room. That's not Dr. B who says that. Official statistics of the American Medical Association. So all the doctor's gonna do quickly, blah, 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 and then give you a prescription. And I wish all doctors would listen to what Dr. William Osler said. First quote, I repeat again, one of the first duties of the physician is to educate the masses not to take medicine. Second quote, the person who takes medicine must recover twice, once from the disease and once from the medicine. Now, obviously, there are some cases when you have no choice. All right, you're suffering from cancer, you need to take medicine. You're suffering from an infection, you need to take medicine. I mean, obviously, at the time when William Osler founded the Johns Hopkins University Medical School program, a ton of things have changed in medicine, surgery, biotech, and everything, right? Obviously, but still, Dr. William Osler is still very absolutely right in many cases of human health conditions, especially when it comes to stress, insomnia, anxiety disorders, depression. I mean, it is crazy how doctors are very trigger happy, you know, like those cowboys, Western cowboys who are very trigger happy and would kill you if you dare to look at them in the eyes. The doctors are extremely very trigger happy with their prescription. Oh, doctor, I cannot sleep. So the doctor won't listen to you at all. He will just prescribe to you sleep medicine. Oh, doctor, I have some tummy ache. Oh, it's okay. Get this medicine. Oh, doctor, I have headache. Oh, it's this medicine. Oh, doctor, I have anxiety because my wife is giving me headache or my husband giving me headache. Oh, it's okay. Get this anti-anxiety medication. Oh, I'm a little bit depressed because my ex-girlfriend left me. Oh, here you go, get this I mean, it's crazy. And now guess what? We know now very clearly that all these antidepressants, sleep medicine, anti-anxiety disorders, proton pump inhibitors that people have been taking for decades for their acidity, many more medications are causing dementia. They are causing chronic inflammation. They lower your immune system. I mean, it's crazy what we are finding now as long-term side effects of all these medications that 50 years ago, 40 years ago, 30 years ago, 20 years ago used to be absolutely, oh, this is a great medicine. Oh my God, how can you say that we shouldn't prescribe these medicines like we are giving peanuts to the monkeys in a zoo, right? Do you remember when all these new medication came out, like these SSRIs for depression, these anxiolytics for sleep disorders, I mean, for anxiety, and of course other medication like the Ambien. Do you remember when many years ago Ambien came out? Everybody was taking Ambien. Oh, the guy cannot sleep. He doesn't try to solve the reason why he cannot sleep. He just takes Ambien. Right? And then now they are finding out they're giving you dementia and chronic inflammation. And I mean, it's crazy what we are finding as long-term consequences of taking these medications that 20, 10, 15, 20, 30, 40, 50 years ago we've been prescribing, and we thought that these are absolutely benign. Well, the guy who was 30 years old 30 years ago, now he's 60 years old and now he's developing dementia. The guy who 30 years ago was 40 years old, after taking this nasty medicine for 30 years, now he's developing dementia. Now he's developing chronic inflammation, heart failure, cancers, and blah, 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 because of decreased immune system. So please, I beg you, never forget William Osler. Try to find a doctor who is caring, who is loving, who listens to you. Think about Dr. B. I don't do family medicine. Dr. B is a cardiovascular imaging expert. I check the hearts of people. Our receptionist at our beautiful cardiovascular clinic in the beautiful but expensive city of Mountain View, she books patients for me every 1 hour. I could tell her, put the patients every 20 minutes and do the exam quickly, get the next patient. But no. I spend 1 hour. From the moment the patient is in my room, I sit down, introduce myself. If it's a new patient, we discuss, we laugh, we joke, we introduce each other. Where are you from? What language you speak? Who is this woman? Who is this guy? Blah. I mean, it's crazy. We talk even politics, religion. I mean, it's good. And then they ask me where you from, blah, blah. I mean, it's crazy. I spend a ton of time. And of course, then comes, the history taking, the complaint, the chief complaint, and what can kind of medications you take. Before I examine the heart of the patient with the ultrasound probe, I need to know the patient. I talk to the patient. I could look at the record of the patient in a computer, but I love to keep it face to face like that. Know my patient, talk to them, show this humane face that we don't see anymore in medicine, except, all right, you get my point. So this is what I spend 1 hour with the patient, but they don't do that anymore. Medicine in the Western world, whether it's Canada, USA, Western Europe, is really going down the drain. So remember to find a good doctor who will listen to you, who will listen to your complaint, who will not be trigger happy with prescription medication, and who will accept to sometimes refer you to a psychologist, to a psychiatrist, to refer you to a sleep medicine specialist, instead of giving you an anti-anxiety disorder or a sleep medicine and kicking you out of the room so that he can make more money to buy his Ferrari, his second villa in Mexico, and blah, 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 right? It is doable. And yourself, make sure that you become your own healthcare advocate and implement lifestyle changes, and which are, of course, the basic foundation of a slow aging regimen. Like this, you won't have anxiety and depression and stress, and everything is linked. Your brain is linked to your body. Exercise, zip your mouth, go on a diet, right? Reduce the amount of stress in your life. Do like Dr. B. Get rid of all your freaking stuff that you don't need. Declutter your life physically and mentally. Dr. B, zero stress at work. Dr. B, zero stress at home. I have zero stress. I have no wife, no ex-wife, no kids, no nothing, no more girlfriends. I own just this apartment, beautiful, pristine, super clean apartment, 1-bedroom apartment, and I own only a 10-year-old Honda Accord, beautiful car, great on gas. I don't need no Lamborghini, no Ferrari, no villas anywhere, right? It's just hassle, it's just a headache. That's the way to age gracefully, to stay healthy, and to not ever need any medication. Not only you will never need any medication, in addition to that, you will not need to go see your doctor every year or every 6 months. Go see your doctor once just to do a little blood test quickly. But you won't need no surgery because of cancer. You won't need no medication because of heart failure. You won't need any medication because of kidney failure. You won't need no medication because of obesity and blah. I mean, it's crazy what lifestyle changes. Where did I put that? Lifestyle changes can completely turn your life around and keep you healthy, successful for the rest of your life until you reach the age of 100 and die peacefully healthy in your sleep, in your bed. And I posted a lot of videos about these lifestyle changes that you have to implement so that you stay away from doctors. Avoid doctors as much as possible, except, of course, where you do your regular checkup and your regular blood test, the same way we take our car for the service, even if the car is running okay. I love you guys. Never forget this. Whenever a doctor wants to give you medication, ask your doctor if it's really necessary. Is there, doctor, any natural way for me to get rid and not take this medicine? Obviously there are. It is called lifestyle changes. Sleep good, have good sex, eliminate stress from your life, hit the gym, and 99% of it is diet. Zip your mouth. You cannot imagine what dieting can do to you. I exaggerate when I say 99%. Let's say 50% of your health and healthy aging without needing any doctor, any surgeon, any freaking medication is diet. I swear to God, you cannot imagine how much the keto diet has changed my life. Now, I'm not advocating for the keto diet. Choose one of the diets that I told you about. I don't know. I posted it before. Keto carnivore, Mediterranean when I was when I was young, and of course the MASH diet. Choose any of these diets. I've been on the keto diet for 10 years now. When I turned early 40s, now I'm 50 years young. But diet is 50% of this slow aging regimen to age gracefully, to stay away from doctors, medicine, surgeons, is dieting. Choose one of these 4 diets, and whenever you diet, make sure that you eat a little bit. I'm on the keto diet, but when I open my mouth to eat from that keto diet, I eat a little bit. It is the key. So make sure you ask your doctor, where did I put it? Always have William Osler in your mind each time your doctor gives you a medication. But again, obviously, sometimes you need the freaking medication because it's a question of life and death. Or if you have heart failure, I'm sorry, but you need medication, right? If you have kidney disease, chronic kidney disease, you need medication. If you have, there's many cases where we cannot follow what Dr. William Osler said, but many times it is absolutely doable the natural way by implementing lifestyle changes in order to age gracefully. I love you guys. Dr. B graduated from medical school more than 30 years ago, and I promise that I will never, ever treat you differently regardless of your gender, ethnicity, color of your skin, political affiliation, sexual orientation, whether you claim to be a man or woman or anything in between. I don't give a cat. So I promise during my Hippocratic oath that I will love you the same, and I promise I will never put my benefit above yours. You will always be above me, and I promise I will always bring you the scientific evidence. The science is here after more than 30 years of accumulating scientific knowledge, and all the science is also here at the National Library of Medicine, search engine PubMed. This is the science. This is not the BS. This is not the influencer on YouTube who said that. No. This is the science. I love you guys. Thank you for your encouragement. Thank you for your criticisms. Thank you for your messages of love, affection. Thank you for helping me grow this channel so that I can help more people. Thank you for stimulating me. Thank you for encouraging me. It is extremely precious to me, and I love you. I really am grateful. Kopkun mak, kopkun nakrap, sawadee krap. Put your question, your comments, your criticism. Everybody is welcome. I promise I will get back to all of you, and I never get offended by criticisms, unlike my ex-girlfriends, and I always respond to even criticism. I hope to talk to you next time. May God bless you and keep you always healthy and successful, and also Dr. B helping you to get healthy and age gracefully. Thank you very much. I hope to talk to you in the next video. May God bless you all. Bye-bye.